Welcome to the Condition Management module on heart failure. My name is Mandy Cutting, and I'm the RN Case Manager with Care Coordination Institute. The objectives for this module are define heart failure, recognize symptoms of heart failure, differentiate between stages and classifications of the disease, describe the role of the health coach in managing heart failure. Guidelines for heart failure apply the principles of evidence-based medicine to the process of guideline development, which are known to be effective in improving health outcomes. The guidelines are designed to improve evidence-based recommendations for physicians and other healthcare professionals about the management of disease or conditions and provide recommendations for treatment. Guidelines are usually compiled by a reliable source, such as the Medical Society or Association, and are intended to optimize patient care. Today, the guidelines we will be focusing on are the American College of Cardiology Foundation and the American Heart Association. What is heart failure? Heart failure is a complex syndrome that is caused by structural or functional impairment of the ventricle filling or ejection of blood. The primary symptoms include dyspnea and fatigue. This can limit exercise tolerance and cause fluid retention, which may lead to pulmonary edema and/or abdominal edema and/or peripheral edema. Depending on where the heart failure is originating from will lead to the different manifestations of the symptoms. Some patients have exercise intolerance, but little evidence of fluid retention, whereas others complain primarily of edema, dyspnea, or fatigue. Because some patients present without signs or symptoms of volume overload, the term heart failure is preferred over congestive heart failure. In this slide, you're able to see the different causes of heart failure. The middle picture is that of a normal heart. The first picture is of systolic heart failure, which is more common in men than in women and can occur on the right or left side of the heart. Systolic heart failure is where the ventricle is weak and enlarged, therefore unable to have the adequate squeeze needed to pump blood throughout the body. The third picture is of a heart with diastolic heart failure. Diastolic heart failure can also be on the right or left side of the heart. The ventricle looks small because of the thickened ventricle wall, therefore it is not able to fill with blood properly. The heart must increase pressure inside the ventricle to fill it. Eventually, all this pressure causes blood to back up inside the left atrium and then in the lungs, leading to what is known as congestive heart failure. When I worked in CCU, we would help patients to understand heart failure by comparing their heart to a kinked garden hose. When a garden hose is kinked, all that pressure builds and causes the water to back up, just like with heart failure. This is demonstrated by fluid backing up into the lungs, the abdomen, or lower extremities. Where the fluid goes is dependent on which side of the heart is affected. So why is managing heart failure so important? As you can see here, it is very common and a burden economically. There are 960,000 new cases per year, and 6.5 million people are affected in the U.S. and it costs $30.7 billion annually. So what are the risk factors for developing heart failure? Health coaches need to know these and the goals for each. Hypertension, diabetes, hyperlipidemia, inactivity, obesity, alcohol, smoking, and dietary sodium. If we can intervene here and help patients get control, we can assist them in changing the trajectory before they go from risk factors to disease state. The risk factors that these conditions can cause are coronary artery disease, heart attacks, high blood pressure, and diabetes. So if we go from risk factors now to heart failure, what does that look like? Let's see what happens. This top picture shows how oxygenated blood is returning from the lungs through the pulmonary artery into the left atrium. through the mitral valve into the left ventricle and out to the body. The patient in this picture has left-sided heart failure and will have symptoms such as cough, palpitations, shortness of breath, dyspnea on exertion, paroxysmal nocturnal dyspnea, which is severe shortness of breath and coughing that occur at night, orthopnea, shortness of breath while lying down, and the newly recognized symptom of dyspnea when bending from the waist is called bendopnea. All of these symptoms are related to the direction in which the blood is backing up, and in this case, it is to the lungs. The next picture demonstrates the blood returning to the heart from being reoxygenated. The blood comes in from the vena cava through the right atrium, through the tricuspid valve, into the right ventricle, to the pulmonary artery. If the patient's right ventricle is damaged due to diastolic or systolic heart failure, the blood will back up into the body, leading to symptoms such as abdominal fluid retention or ascites, jugular venous distension, which demonstrates by the pronounced neck veins, shortness of breath, frequent urination at night, swelling in the legs or feet, fatigue, weakness, and faintness. Again, all this is related to which direction the blood is originating from in the damaged ventricle. In this case, it is the right ventricle. Heart failure diagnosis. How is it diagnosed? Heart failure is first diagnosed when a patient presents in a crisis requiring hospitalization. The illness is marked by exacerbations, gradually increasing in frequency. However, the slow decline of the patient, just like COPD, of the patient between exacerbation is often missed by both clinicians and family members. Patients become accustomed to their norm and don't realize the slow decline until they are in a crisis. Thus, again, the patient's death can be unexpected. Let's look at the different stages and classes of heart failure. Stages of heart failure, as seen at the top of the slide, demonstrate risk factors to development of the disease. This slide discusses the stages of the heart failure. Stage A, risk factors are present, but no evidence of disease. Stage B, heart disease is present, but there are no symptoms of heart failure. Heart failure is usually only diagnosed in this condition when, such as an MI, has led to increased testing. Stage C, heart disease, has caused structural changes and now symptoms are present. Patients without a past MI or stroke may be only first diagnosed with heart failure when they develop a sudden onset of symptoms requiring hospitalization. Stage D is the final stage. Heart disease is advanced with worsening symptoms and aggressive management is needed. Classes of heart failure show the progression of the disease related to physical limitation. Class 1, there are really no symptoms, to Class 4, where symptoms are severe even when patient is at rest. Patient's ability to maintain their independence is important. Health coaches are a vital part of helping these patients maintain their function for as long as possible. Early interventions are necessary to helping patients have an improved quality of life. So what can we do? What are the interventions and how do we manage this condition? The interventions are broken down by the stage of heart failure the patient is in. Stage A focuses on eliminating risk factors that can lead to heart failure. Stage B focuses on starting medications to keep the patient's heart from worsening since no symptoms are present. Stage C, symptoms are now present and now patient will notice doctor discussing increasing or adding new medications, salt restrictions, how to monitor their weight, restriction of fluids, and may recommend pacemaker or an ICD. Stage D, the patient is severely impaired. Doctors may suggest heart transplant, a ventricular assist device, surgical options such as heart transplant, continuous infusion of inotropic drugs, and hospice consideration. There are interventions to be taken that begin with recognizing risk factors. If we help patients to eliminating their risk, we can lessen their chances of ever developing this. Management of heart failure spans the continuum and involves care management in the physician practice setting, hospital, home care, long-term care, and hospice. Stage recommendations are further broken down by class in the evidence-based guideline. This is a high-level overview of potential treatment recommendations. In general, all recommendations for patients with stage A heart failure also apply to those with stage B heart failure, and so on, particularly with respect to control of blood pressure and lipids. Self-care regimen for patients with heart failure is complex and multifaceted. Patients need to understand how to monitor their symptoms and weight fluctuations, restrict their sodium intake, take their medications as prescribed, and stay physically active. They too have a part to play. Coordinated care. How do we coordinate all this care? We start with communication between the patient, providers, and health coaches. Patients need to understand they have a role in their health and need assistance in taking the necessary actions to maintain their well-being. 2. Medication reconciliation. Are the patients taking their medications as directed? Are they having any barriers of 40 or having difficulty with side effects from their medications? These are things to consider when talking with them. Carefully planned transitions is number 3 between care settings. As the patient's condition worsens, how is the family coping? Do they need extra help in the home? Is it time for the patient to transition to palliative or even hospice care? These are things to be considered. Consistent documentation, making sure everyone is consistent so as to gain a clear picture of the patient and their condition as the disease progresses. The health coach plays an integral role in helping in the continuum of care of this patient and can be instrumental in educating patients on why it is so important to stay engaged in ongoing lifestyle management to prevent future heart events. The health coach can help the patient focus on managing the stress of normal daily life and learn to integrate relaxation techniques that can minimize stress on the heart, understand how to remain physically active, and engage in healthy eating, and how each of these aspects can improve the health of their heart and prevent future complications. Engaging families and caregivers in the ongoing process of managing heart disease and help all individuals involved in their life to engage in healthy supportive behavior. For example, helping family members go from frying foods to maybe even a plant-based diet can help the patient and the family all be healthy. As we discussed earlier, palliative care is of importance. As the disease progresses, they can assist the patient with symptom management, dealing with psychosocial distress, assessing what they want for quality of life, helping to plan for end-of-life care while supporting the caregiver come to terms with their loved one's condition, and providing access to disease-modifying interventions. As the patient and family move through the process of coming to terms with their loved one's condition, they may decide to remain at home as long as their symptoms can be managed and can remain comfortable. Hospice fills this need. They will provide medical care to manage symptoms, provide emotional and spiritual counseling for the patient and their family, respite care when caregivers need a break, home health aides, help with insurance, legal documents, and other practical issues, as well as bereavement support and counseling after the patient passes for the family. As with other conditions, again, early intervention is key. Education and empowering the patient and family to take control of their health is of the utmost importance. Health coaches are well equipped in this area, an important part of the healthcare team to make a difference in these patients' lives. Thank you.